It's my pleasure to be here and to get to sort of virtually see and meet all of you all. I've been the legislative chair for the South Carolina chapter for the past 3 years. So I vividly remember coming to my first training. So I know there'll be a lot of information, but it's very helpful. And of course, we're always here to help if you have questions beyond the training tonight. So I'm going to start by just going over the legislative chair roles and responsibilities. Hopefully I try to make it a little exciting, although I know it's a lot of information. But first of all, the legislative chair serves as an advisor to the chapter board for any decisions regarding state legislative or regulatory activities related to APRN practice or child health policy. The legislative chair participates in state level policy collaborations with other APRN or child health groups. So things like state organizations such as maybe the AANP state level organization, or coalitions for advancing APRN practice, things like that that are at the state level. You communicate with National Health Policy Chair in cases where state policy may challenge NAPNAP's health policy agenda or positions. And that's very important. As you learn of state legislative initiatives, try to bring in the Health Policy Committee early on and consult with NAPNAP for guidance. That way, as things are being developed and moved forward, we can make sure that everything's in line with NAPNAP's and other major APRN organizations' perspectives on legislation. The legislative chair also attends monthly NAPNAP Health Policy Committee meetings, and if possible, the Child Health Policy Learning Collaborative meetings. And these are great ways to learn about things going on nationally as well as state level across the country, and also to help support you as you're going through state level legislative issues. You also receive and respond to communications and requests from the national office regarding national and state legislative or regulatory issues. So these are things like the calls to action that Michelle and NAPNAP will send out periodically, or occasionally there'll be requests to sign on as a chapter to different letters or in support or against different initiatives. Excuse me. Also educate your chapter members about legislative and regulatory issues at both the state and national level. The legislature also attends legislative trainings and sessions at the national conference. You participate on standing committees or other committees or task forces as appointed by your chapter president, and provide input on Chapter 12 reporting specifically towards legislative or regulatory issues that you're following in your state. So the National Health Policy team consists of your co-chairs. As Sarah mentioned, she is the chair of the Health Policy Committee, and I'm the co-chair. Dave Mason is our wonderful federal advocacy expert. Michelle Stickle is a NAPNAP staff member who is incredible. I think you all know her. And she is in charge of state advocacy and policy operations. And then we have a 13-member Health Policy Committee that does meet monthly. And I will turn it over to Sarah to go on with the rest of the slide.
Thanks so much, Kelly. And I'm just going to talk a little bit about the National Health Policy team and some of our efforts that we can offer to support you, but also would welcome your action and input. So the Health Policy team has a couple of different roles, which I'm going to go through. The first one, the most obvious one maybe, is just trying to engage our members in advocacy efforts, federal advocacy efforts. And that could be things like the calls to action that Kelly mentioned, but also things like Capitol Hill visits or the Child Health Policy Learning Collaborative calls, and some occasional conference sessions, whether those be one day in person or all virtual. We are kind of report to the executive board on all things policy. So some of our partners or leaders who take a position, or legislator who basically any kind of action that we might consider taking as an organization, we may work with the executive board to advise them or to speak to the historical experience or the health policy perspective on one of those matters. There's a lot of draft letters and comments on national legislation or regulations that NAPNAP is asked to sign on to or to sign on in support of. And those are all channeled through Dave, who does a wonderful job at triaging and kind of helping guide the health policy committee. But I think sometimes we still have to have conversations as a group about whether something is appropriate for us to sign on to or not. We support the chapter leaders in anything we can, information, resources, or requests. But we also try to work closely a little bit more recently with our special interest group SIGs on anything related to policy issues. So we're trying to kind of capitalize on the child health specific experience of those SIGs when it comes to any kind of advocacy efforts. So what are some action items for you at the state level? It's really so important that we have your action and advocacy. It's more important really even than just kind of this health policy activities of the committee at the federal level, because you're really on the ground and it's, your state, your region, your community. And you can kind of keep your ears to the ground and let us know about things that are going on so that we can be aware. So some key roles are to, first of all, consider tracking some legislative or regulatory activities, which I know that can take a lot of time. So it's, it could be a full-time job in and of itself, but you can work with other nurse practitioner groups or other pediatric childcare groups like American Academy of Pediatrics to track issues related to advanced practice nursing or any kind of child health issues. The most important thing, if you've been to any kind of policy or advocacy workshops, they'll always emphasize the same thing, and that is to build relationships with your elected officials or whoever represents you in your region, but also if you can, your state insurance commissioner, health department, any of those folks are really important if they know you and they know who you are and they know you're a nurse practitioner and what you do and who you serve. It's just really important to kind of facilitate advocacy efforts at all levels. And we'll talk more about that on another slide. You can seek the guidance of our health policy team anytime, but particularly if you're ever asked to kind of decide whether you support or oppose something, you could always liaise with us to help focus those discussions based on our strategic plan or health policy agenda. And if you have those requests, you can reach out to us at healthpolicy@napnap.org. But particularly if you're ever asked for a position on a federal, any kind of federal matter, legislation, regulation, definitely reach out to us so we can help with that process. Okay, so all politics are local. I think that's never been more obvious than it is going into this election, coming out of the last election, I guess. So please register to vote if you haven't already. But when you are voting, just some suggestions are to consider paying attention to your the child health positions of local candidates, as well as their position on advanced practice nursing if you know it. A really interesting or great idea is to consider offering an award as some kind of child health champion award to a legislator as a way to gain or get noticed. It's kind of like some good PR to present a legislator with an award. So you can always talk to the national office for more information about that. Really important to always introduce yourself to anybody that you interact with, but even people who may not agree with you, I think it's really important to always be cordial and polite, which may go without saying, but it can be hard in these partisan times. But it's really a key for grassroots advocacy to be to introduce yourself, to make yourself known, and the fact that you are a nurse practitioner. Another idea is a fundraiser. If you can't, afford to write a big check to a local campaign, which many people can't, you can always, host something or host something virtually at this time that kind of introduces people in your community to a candidate. That's something that you can do to sort of get your kind of get to know somebody or to make your organization or profession known. Some other ideas for building relationships are, again, some of these are harder right now given what's going on with the public health crisis, but this is a note for the future. Hosting town halls, which of course could be virtual, but to educate officials and staff about a child health issue, but to get to know people. For those of you who may have been able to attend our September 2nd Child Health Policy Learning Collaborative call, Nancy Kavanaugh and Kathy Lux were able to speak more to this relationship building based on their experiences, which are extensive and have been very successful over the last couple of really many years, building relationships with their local representatives, and how that's helped facilitate a lot of conversations about advanced practice nurses, but also child health policy in general. You can send notes, you can send articles. If your institution will allow it, you can even invite for site visits to your practice. But the easiest thing to do is definitely to follow on social media and to share or retweet, if you're on Twitter, anything that you support. And the more people that do that, the more notice that would get from, for instance, a legislator. And so the more you can plug those types of opportunities into your chapters or whatever channels you have, the better, to help kind of get the attention of any kind of elected official. Next slide. Okay, sorry, I keep forgetting to tell you to advance the slide. Okay, making it personal. You know, it's funny how much elected officials may seem like they're in an ivory tower, that they know a lot about a lot of things and they understand the nitty-gritty details of all sorts of issues. But the truth is that they really don't. You know more about child health policy almost certainly than many elected officials, but you certainly know more about your own community's child health care than they do. And if you just present people with data, I think all of us as healthcare providers know that doesn't necessarily get people to do what you want them to do or help people realize what you want them to realize. People really engage with stories. So stories that are compelling and well told and to the point, you know, that have clear action that comes from them, I think are the best kind of stories. So always try to consider how you can tell a story and tie into emotion so that you make an impact and that people remember you and remember what you were talking about. Because elected officials do meet a lot of people all the time and they all have an ask. So making it about a story is the best way to be remembered. So this is just an example of a compelling story of something that illustrates why this particular issue mattered to the constituents or the voters in the district. But you, I'm sure, have stories of your own that illustrate these types of things. And the phrase affecting our friends and neighbors in our district is a good one to tie it back to their constituents, to their voters. Like I said, being concise, you don't want to tell a long rambling story, of course. You want to be quick and to the point. And if you have any kind of graphic design ability, one-page infographics or things that are very easy to digest can be very effective. And if you are collecting these types of stories from members, it's a great idea to try to build those into some sort of repository so that you can use them in the future or tie into them in other visits or with other kind of media things that you do. And for states that do have multiple chapters or multiple chapters within a small geographic region, it's really good to get to know each other and definitely don't be strangers. Many of the issues that you might be working on, they may already have worked on or may be aware of, or you can kind of pull your resources. And establishing some kind of regular communication is a great way to do that, make sure you're all on the same page. But you can also divide and conquer. So like I said earlier, bill tracking can be really time consuming. And some of these processes can take a lot of time or effort, which we don't all have, at the end of the day when we're all working, probably all working. So being able to share those responsibilities can be very helpful. But whenever at all possible, agreeing on a common message is the most effective way to approach any kind of issue, because if one chapter supports something and another chapter in the region does not, that could be very confusing to elected officials who don't necessarily understand the nuances of different chapter geographic catchments. And there's also, of course, external groups and seeking out partnerships. Thank you, Michelle. Seeking out partnerships with those groups is definitely advised. March of Dimes is great. American Academy of Pediatrics has enormous membership. Children's hospitals, injury prevention coalitions, other APRN associations like AANP, or you could build your own. You could create some kind of catchment of people with interests, aligned interests. And your voice is important, but the voices of hundreds of constituents will get way more attention from officials and the media. So reaching out to other groups whenever possible or whenever interests are aligned is always a good idea. Some topics that are kind of what we consider hot topics and that certainly have available policy work that remains to be done are listed here. And just remember, you really are the experts probably in many of these areas. So don't feel, you should feel confident about that. When you approach an elected official, you certainly know more about these things than they do. And you should make sure that they understand that, as well as other agency leaders and media, other people you interact with. And this is just obviously a partial list, and your chapter may have other issues that you consider more important or that are more specific. And certainly we encourage you to take those on if they're something you think are important and your chapter agrees.
Thanks, Sarah. When I think about the topic of what to expect in 2021, I'm tempted to say, darned if I know. But actually, the federal agenda depends a great deal on the outcome of the election, as you know. And there are several things, all of the topics on this slide are going to be issues that Congress and the next administration will be dealing with. It's just a question of how they deal with them, what is doable, and what kind of perspective we'll have on them. The clearest example of that is the first category here, where we're talking about policies, where we'll either be talking about repealing and rolling back current policies or restoring and expanding current policies. The Affordable Care Act that we've talked about previously, and healthcare coverage generally, is a good example that will either be replacing it or trying to build onto it. Similarly, in the area of immigration, the Deferred Action for Childhood Arrivals program, or public charge regulations that apply to immigrants and families, those will either be issues that we're looking to repeal, roll back, put new policies in place, or to try to figure out ways to work with the existing programs. And then there are a host of environmental regulations that have been modified over the last 3 years that a new Congress and a new administration will be revisiting, either to strengthen or to weaken further. So those are clearly issues that nursing will be involved in. It goes without saying that the coronavirus pandemic is still going to be a topic, and the ongoing public health and economic responses. I mentioned the potential issues around vaccine allocation and distribution, payment for administration, all of those kind of issues. Beyond just the COVID pandemic, disaster preparedness in general, and trying to build the workforce, stockpile protective equipment. And then as Congress and the administration are currently talking about economic aid for families and businesses who've been devastated by this emergency, and also all of the natural disasters and emergencies that the country has faced this year. Having said that, there is currently and will obviously continue to be growing pressure and concern about the federal budget deficit and the drain on Medicare trust funds. So pressure to find spending cuts that could easily affect programs that nursing cares about. And then going back to some of Sarah's messages about building grassroots relationships, regardless of the outcome of the election, there will be changes in House and Senate committees, in their membership and their leadership. And all of those are challenges, but there are also new opportunities for building or strengthening grassroots relationships. When it comes to the committee structure, by February, we'll probably have a pretty good idea of who will be chairing committees and who will be members of committees in both the House and the Senate. So there will be a lot of attention, and NAPNAP will be providing a lot of information, what those opportunities look like by that point. And Sarah, I'll turn it back to you.
Actually, I'm going to take this one. So what to expect in 2021 on the state level. And again, you are the boots on the ground. And so you may already know these issues. You may already have some other ideas from your work that you're doing at the state level. But we definitely have heard that some states will be having the introduction of the new APRN compact. NAPNAP did issue an official statement opposing the APRN compact, and I will show you in just a little while where to find that on our new website. So this new compact requires, I believe, 7 states to ratify the compact before it becomes a true compact. There are some concerns about it, which is why we opposed it. For example, it requires 2,080 hours in a transition to practice type of situation. And that negatively affects states that don't have a transition to practice and already are sort of green on the policy, excuse me, the practice map. So again, that's something to be concerned about. If that's going to be introduced in your state, you really need to take a look at the APRN, the new APRN compact that has been issued by the National Council of State Boards of Nursing, and decide how that is going to impact your members and how you feel about that. Practice bills or other things to watch out for. So those of you who've been joining us for our calls over the last several months, you have heard about some of the different problematic language in certain states. California, Pennsylvania are 2 of the most recent states that have problematic language that, should other states pick that up, medical opposition in other states pick that up and try to get those amended in, that would be a negative impact for your state practice bills. So watch for language about location-based restrictions, extensive transition to practice hours. We've heard as many as 3,000 to 5,000 hours, which is several years. Any type of creating or adding regulatory oversight by physicians. You'll notice, I think is either California, Pennsylvania, I'm blanking right now, but one of those states, instead, I think it was California, instead of having having to have a signed relationship, a contracted relationship with a physician, they're saying they're withdrawing that, but they're not going to put physicians at a regulatory level. So it's just a matter of moving the physician oversight from individuals to more of a state-based type of system, which still is not good. Requiring any type of new certification exams, pilot study instead of a practice bill is what's being used in Pennsylvania these days. And there's always the truth in advertising language that implies that nurse practitioners are not honest in how they call themselves if in fact they have their PhD or their DNP degree. So those are some of the buzzwords that you want to look for in state practice bills. And again, look very carefully at those bills to see if it's a compromise or if it's going to actually go more in favor of the medical community, the organized medicine. Also, you want to look for pediatric focus bills. Hot topics these days: immunizations, vaping, tobacco, and sports concussions. There might be other bills that are relevant in your state, depending on where your state is. States that are perhaps more rural, you may see, minimum age for ATV and different things like that that impact child health and injury prevention types of bills. Also, environmental bills are going to be probably seen more at the state level. If the federal government rolls back environmental protections, certain states are actually going to be implementing those. We saw a little bit of that over the last few years in some states that are perhaps more focused on environmental causes. So look for those environmental bills, including bills that may tie together environmental impact on healthcare and health outcomes.
I think I'm going to just talk a little bit about some of the resources that NAPNAP has, and Michelle's going to actually show some different tools. We just also, I hope I can emphasize how much we value our chapter members and our chapter legislative chairs, because monitoring state level child health advanced practice nursing bills and reporting to your boards is a very big job on top of whatever your professional and personal responsibilities already are. So over the last few years, NAPNAP's really been trying to provide more resources and collaborative information, as well as one-on-one assistance for whatever support you need to accomplish what you want to accomplish. And so a couple of the online resources and opportunities that we have right now are, first of all, our monthly health policy committee call or meeting, which has transitioned to kind of the Zoom meeting actually in the public health crisis, where it used to be a phone call, which has been really nice to see people's faces and to talk a little bit more face to face. But that's an opportunity to talk, to collaborate with the national policy leaders and also our health policy staff. And then also, which is something we've mentioned a few times today, is the Child Health Policy Learning Collaborative monthly calls, which are open to all members. So you don't have to be a legislative chair or any kind of chapter leader. Everyone is welcome to attend, but they are on a variety of health policy topics, usually really experienced and knowledgeable speakers on different issues, and often focused on state or local topics. So we highly encourage all the legislative chairs to attend those whenever they can.
And I'm going to actually change over what we're going to look at. So I'm going to take the slides down, and I'm going to instead pull up our website. One second. I'm now sharing our website. If I can get a thumbs up if everyone can see the website. Thank you. Alrighty, so this is our new napnap.org. And if you haven't taken a look at it, I highly encourage you to do so. You'll notice here in the middle of the screen, there is a tab called Advocacy. So we're going to take a spin through this channel so you can see where some of these resources are. Sarah mentioned our Child Health Policy Learning Collaborative. So I'll just very quickly show you on that page. Excuse me, I'm just move this over. You actually can see different information about the upcoming speakers, and we are also recording those calls now, so you can actually watch past events. So if you scroll to the bottom of the page, you'll see the past events. And all right, so if you scroll up and down, you'll see more information about the speakers that are coming up. We have our health policy agenda. This agenda is put together by the Health Policy Committee each year and approved by the Executive Board. So you can, again, visit our health policy agenda to sort of get a sense of our positions and priorities and goals. And again, we ask that all of your state level advocacy activity align with the health policy agenda. If you see something that is conflicting with something that you want to do in your state, please reach out to healthpolicy@napnap.org, and we'll bring that forth to the committee for consultation. We also mentioned our advocacy center, I believe. And so our advocacy center actually is a module system that we use. It gives you different campaigns that we have in play. You can actually click on either of these campaigns and send a message that's pre-formatted to the your elected officials. You just scroll down and simply fill in information that is listed here and hit send message, and that goes through the automated channels directly to your elected official's office. In the Advocacy Center too, there's an opportunity for you to learn more. If you, let's see, if you scroll down underneath this campaign, you'll see sign up for alerts. And so that way you'll get information about our calls to action, but I think most of you are already getting those. You can also search legislation or view key legislation. So if you click on the view key legislation button, you'll actually get to see the federal bills that Dave is working on and the committee is working on. We broke those down into different categories: child health and welfare, general health care and regulations, COVID, immunization. So if you just scroll down, you can see different bills. And if you click on any one of these bills, it'll actually take you into more information about who the sponsors are, what the status is, what the actions are, and whatnot. So you can just scroll up and down on those. Alrighty. So at the bottom here, I mentioned that you can also find your elected officials. So if you don't happen to know who those are, because they do change, especially election time, type in your zip code here, and you can hit, and it actually shows you your candidates too. That's an option right now. And if you type in your zip code and hit the little arrow, it'll take you to a list of all of your elected officials, and you can actually decide if you'd like to send them a message. So you don't have to use our messages that we have pre-formatted. If you have a message that you would like to share, you can do that by just typing in your address. It gives you a list of your officials, and then you can just check. If you want to send a message to a particular person, you check that person, and then you just follow the prompts and compose your message. And again, that goes through the automated systems directly to those federal or state officials. Also in our Advocacy Center, you can actually track legislation. So if you enter a keyword, if we say immunization and we hit the little arrow, the immediate results are going to pull up federal. But if you'd like, you can pick your state, and I'll pick California. Immunization is still the keyword. Hit search again, and now it's going to give me all the bills from California. And again, it shows you just so many. There's a next button here with pages and pages of different bills. If you click on any one of these bills, you'll be able to see more about the bill that's coming from that state legislature. So the system ties into what's publicly available from state legislatures. So that is our Advocacy Center. And again, you can reach that by going under our Advocacy tab. Also, I'd like to show you our advocacy resources. And so these resources have been put together by the committee and Dave and folks at the state levels have passed along great resources. So these also we have organized into different categories: children's health coverage, child health equity, public charge, child health data, practice workforce issues, general advocacy training, state level tools. And if you open up any one of these accordions, you'll actually see numerous links, and you can click over to see their perhaps uploaded documents. They might be links to other websites, to other journals, whatnot. And so if you click on any of those topics, you can find resources there. And if you ever come across a resource that you think would be a good piece to add to our website, please email that to healthpolicy@netmap.org. We appreciate your opinion and input. Alrighty, so the other thing I want to mention here is our Inside the Beltway. So Inside the Beltway comes out every other month, and we will have one coming out in October. And so actually comes out later this week. But you can scroll down and look at any one of our Inside the Beltways to learn. We always have a guest columnist that's the top story, and then we have different information and news reports from Dave at the federal level. So again, please take advantage of all the tools under our advocacy section of our website. Earlier, I mentioned our official statements. If you go under news and resources, under news, you can look up association updates, official statements, and press releases. Under publications, you can see our position statements and white papers. So again, these top couple of buttons here under news and resources are helpful. So if you go to look at our official statements, it'll give you the list of all of our official statements, and you can scroll down until you find the one that you want to review more carefully and read more. Alrighty. So state bill tracking, thank you. Some folks have shared some ideas about state bill tracking. As Sarah just mentioned, you can track through our Advocacy Center. It does not allow you to give notification. So if you want to have a notification on a particular keyword, that tool is not available in our system. That tool may be available in your state legislature's system. So can't say for every state. I've never checked all 50, but almost everyone, based on what I've heard from others, each state legislature has its own bill tracking system. Some are much more robust than others. Some will allow you to sign up for notification emails when a particular word is in a bill. Others, you have to manually search that word. And again, the state legislature bill tracking is a free tool and is something that is fairly easily accessible. It just is a matter of the level of detail. Certain states don't put as much detail in as others. There's also some paid types of services out there. Bill Track 50, that's free to research bills, much like the system I just showed you from our advocacy center. But if you want to have the alerts and tracking, meaning the emails that come in, you have to actually pay for a subscription. So it's $550 per state that you want to track. Legiscan is another one that's free for that research piece that I showed you through our advocacy center, but it's can be quite costly when you get the professional version, depending on the number of licenses and how many features you want. But that would give you also that alert notification system. And then TrackBill is another one that requires an annual subscription. It is a web or mobile app, but I think the mobile app's only available on iPhones. But again, annual subscription to get receive those alerts and notifications and whatnot. So these are tools that if you are wanting to pursue more specific bill tracking in your state, you may want to take a look at. Again, take a look at our advocacy center to see if what we have is available to you for free would work.